Good day. It's been a while since the last time I posted anything new, and now I'm turning back to Rhinology. For things I wanted to show was another complete FESS. In this case, we're going to enter, as usual, the first the uncinectomy. I like to do it with the backbiter a lot. So if you do 3 bites more or less, you can enter widely the natural ostium of the maxillary sinus. Then to retract it your way and to eat it up with the Kerrison forceps just to get a good view of the bulla. Next thing I like to do is to open the suprabullar cell, the Agarnasi cell. In this case, we're going to use the Kerrison forceps to remove the frontal process of the maxillary bone, and then to remove the Agarnasi cell in order to expose the supraagar and the suprabullar cells, the frontal-ethmoidal cells, just to get us space to enter the frontal sinus. That it's supposed to be the most difficult sinus to enter. Actually, and I like this very good technique that is called the Intact Bulla Technique. Now you're seeing that I'm dissecting without any fear all the suprabullar cells, because I know that the limit of the skull base is the face of the bulla. Everything that is superior and anterior to the face of the bulla, it's frontal sinus, and it's not skull base. So once we see correctly the natural ostium of the frontal sinus, I like to use a patty to enter the frontal sinus and to remove a little bit of inflammatory mucosa. Now we're expanding the natural ostium of the maxillary sinus, and give it some time to the vasoconstrictor solution to work in the natural ostium of the frontal sinus. I like to use a lot the microdebrider. I believe that is a very useful tool to reduce a lot the surgical time. So you can remove all the mucosa and all the bleeding mucosa, and in this case you see that the maxillary sinus is wide open. Now we're going to remove the patty, and you see that the frontal sinus is almost open from the previously dissected lamina papyracea and the middle turbinate. So it would be more or less type 2A, draft 2A. Now we're going to enter and continue our dissection, opening the face of the bulla and entering the anterior ethmoidal complex. I like to open it with a normal black slate forceps, and then to remove the rest of the cells and the mucosa with the microdebrider. After that, now we're going to dissect and open the third lamella, that is the basal lamella of the middle turbinate, in order to enter the first posterior ethmoidal cells. Remember that the posterior ethmoid has bigger cells, and there's a complex between 3 and 5 cells. So now we're removing debris in the middle just to try to maintain most open, wide approach. And now we're going to enter the sphenoid sinus. To enter the sphenoid sinus, you can remember that you have to dissect inferior and medial to the first frontal ethmoidal cell in order to enter the sphenoid sinus. And it's one of the ways to enter the sphenoid sinus. You can approach it in various manner of ways. This is one of them, just inferior and medial to the posterior ethmoidal cells. You will find it. Now you can see the wide view, the final view of the surgery, and that's perfectly open.